My name is Justin Lightburn, and I'm an interventional radiologist here at Goshen Hospital. Uterine fibroids are benign tumors that grow in the smooth muscle or wall of the uterus. They will tend to cause symptoms of prolonged bleeding and pressure and frequent urination. So usually the first thing the patient's going to do is go see the OB-GYN. So they're going to direct them to different pathways in terms of therapy. One pathway is medication, so hormonal control, and then if that fails, then the other thought is an intervention of some sort. So usually that it's a surgical resection of the tumor itself, which they call a myomectomy, or a resection of the entire uterus, which is called a hysterectomy. Often, if the patient is not interested in a surgical intervention, the OB-GYN will often refer the patient to us, interventional radiology. So I would treat uterine fibroids through a procedure called uterine fibroid embolization or uterine artery embolization. So almost anyone's a candidate for uterine fibroid embolization. The only patients that would not be are patients that are seeking to have children in the future, or patients that the tumors are seen to be precancerous or cancerous. Then those individuals wouldn't be able to have it. But outside of those two groups, everyone else is a candidate. So if the patient were to come to see me in interventional radiology, then I would access either the radial artery or the common femoral artery in the groin. We advance our catheters into the aorta, take pictures and with contrast, and make sure there are no other blood vessels that are coming off and feeding the uterine fibroids. Then we subselect each of the uterine arteries and inject tiny beads that block off flow, leading to the embolization and then death of the fibroids. And then after the post-procedure, the patient will be admitted overnight. Often the pain in the first 24 hours may require an epidural to be placed. After the first 24 hours, then we'll evaluate the patient and see how they're doing, and usually discharge them home. After that, it takes about 1 to 2 weeks for the patient to return to normal and then get back to their normal activities. During that time, the fibroids will be starved of blood flow, and they will continue to die over a period of a few weeks. So typically after uterine fibroid embolization, the symptoms of uterine bleeding will usually stop due to shrinkage of the fibroid. The symptoms of pressure or pain in the pelvis also will usually stop after the fibroid is shrinking. The symptom of frequent urination will also often decrease as the fibroid shrinks and there's less pressure on the urinary bladder. The vast majority of patients exhibit symptom relief. In the rare case if the patient does not, then they'll be referred back to the OB-GYN for possible hysterectomy.